My name is Christina. I am a registered veterinary nurse. I'm also the general manager here, and I've been here since 2003. And I often call this hospital my baby because I've started it from the ground up. When I first came in here in 2003, it literally was all construction. It was just bare wood walls. There was nothing here. So it's my baby, that's what I call it. So Dr. Hamilton definitely adds a great personality to the staff. He is fun. The clients absolutely love him. He is energetic. He's a great doctor, and it's almost like he is the piece of the puzzle that we've been missing.
After I got done with Cornell, I already worked with the Callanans for a while as a technician, and then I got my shot to be the doctor, and it's been great. It's challenging. You know, every day there's something new. You're always learning, but my work day is not a work day. It's more of just a go have fun and do your best to help other animals. That's basically what it is to me. What I love about the job is how dynamic it is, right? You're seeing a cat that's really nice, you're seeing a dog that is very aggressive, and you have to try and figure out how to manipulate around the situation where everyone is safe and no one gets bit, but at the same time you're thinking about the patient because you know that they're stressed out and you don't really want to hurt them, but they don't know that. So a lot of it is basically putting together like a puzzle and trying to figure out like how this is going to be the best way to work.
Good besides puffy here.
And when did you notice that hematoma?
Last night?
Okay. Did he let you touch it?
Yeah. He keeps moving his head a lot.
Shaking his head,
Yeah,
scratching at his ear.
it.
Yep. I'll just take a heart rate and a rest break. Hello, handsome guy. How are you doing today, huh? Hi, you want to smell this? It smells pretty good. What's up, bud? We have Polo here today. He's in for an oral hematoma, so his ear is swollen with fluid and some blood inside. On presentation, he's a very nice dog. He's very happy. He's pretty decent with other dogs, and that's always comfortable when you have, you know, other dogs in the waiting room and stuff. And then for me to be able to deal with him gives me a different level of comfort as well, because I know I can kind of put my arms around him or put my stethoscope on him and things like that, and I know he won't get upset or nervous or maybe try to snap at me or something like that. He's a good guy. I like him. All right, so we have Polo. He's a male unneutered pit bull. He's presenting for an oral hematoma today. He's never had one before. Owner said yesterday he started shaking his head and scratching, and then by the end of the night he had noticed the bubble in his ear. On presentation, he's very BAR. He has a normal heart rate of about 120 right now, pink mucus membranes less than 2 CRT, and he's panting pretty.
Nervous, okay. All right, let's go take a look. Which room?
We are in the first room, the blue room.
Okay. How you doing, sir?
Good.
Dr. Hamilton, nice to meet you. Have we ever had any issues in the past with any allergies or ear infections or anything like that? A lot of times, secondarily to ear infections, they might have basically an issue with the ear. They start head shaking it, and then that creates basically the rupture of some of the vessels, and you get the oral hematoma. In order to correct it, what we usually do, first we try and find the source. I'm going to check the ears to see if basically there's an ear infection going on in there. That probably could have been the inciting cause. Then after that, what we're going to do is, if we do need to correct that, we just have to sedate, and I have to basically make an incision, okay, an S-shaped incision in the inside of the ear, get all that blood out, okay. So the reason why we make an S shape is so we have drains in there, okay, and it's allowed the blood to drain, and then I basically suture that in place, and then we put an e-collar on, and
Today?
we could do this all today. Okay, we'll be right back, sir.
Okay.
Okay?
Thank you.
All right, no problem. All right, bud. Turned out it was an oral hematoma, and the ears had an ear infection in it. And a lot of times these oral hematomas are secondary to something, right? And so in his case, he had an ear infection, and you know, they don't have hands and can get Q-tips in there, so they just start either pawing at it with their paws, and sometimes you'll see excoriations or scratches along the back of the neck, or you know, they'll head shake, right? And when they head shake, you know, the force that's the ears are going back and forth, flopping back and forth, some, you know, vessels can rupture, right? And so if that's the case, then the blood then, you know, between the two layers of the ear, the pinna, it starts to fill up with blood, and it becomes inflamed and painful, right? So we have to go and we have to fix that.
So the endotracheal tube is in, so now we can place him on the breathing anesthesia.
And yes, Karen, if you could shave this side on this side as well, but here, and then also do a good ear cleaning.
Okay.
And then when we're ready, if you could take a cotton ball and place it in there, just so we don't get a lot of blood in the ear canal.
And the last thing I'm picking up is, rather placing in him, is our temperature probe, so we can keep track of his body temperature under anesthesia as well.
Alright, so now I'm just gonna clean the area, make sure it's sterile for the doctor, for as clean as possible.
All right, I'll be making my stab incision right here. All that blood just has to come out. So it must have been present just for more than 24 hours, considering the inflammation. I could feel it through there. It is still pretty thick. And so we're gonna inject the ear with a steroid. Thank you. I'm gonna slosh it around a little bit. Okay. I was squeezing the blood out, and then some of this fibrous tissue was coming out, and so a lot of things were going through my mind. So this is vet medicine to a T. This is, okay, everything is so dynamic. Like, nothing is what it seems, all right? You could be prepared for it, but then something like this happens. So I was like, all right, well, in my mind I was thinking, instead of just trying to keep squeezing this stuff out, which I could feel it freely moving in there, I'm gonna just make the S incision anyway, get a better look. Make an S shape. And now that I have access to inside the ear, you can actually see everything that was kind of coming out of that little hole. All this junk we got to get out. That's when you have those boxers, or shall I say wrestlers, that have cauliflower ear. You get all this fibrous buildup, and then it solidifies and it becomes hard. So we got to flush all this out, get all that out of there. So that's a mixture of fibrous tissue and clots. And now I need some saline flush. Okay. So as you can see, with fibrous tissue too, it creates adhesions, okay? And so there's adhesions to the skin right here, it's attached.
So draining that hematoma and having, first of all the clots coming out was pretty interesting. You don't always see that. As Dr. Hamilton had mentioned at that point, you know, we do kind of see hematomas a lot in the ear. However, we don't always see them when they've kind of sat there long enough to get these weird blood clots inside.
Notice how when I remove this fibrous tissue, the skin underneath is very smooth, okay? The dermal layer underneath. I'm trying to do as much of that as possible so you don't have the cauliflower ear. So, I removed as much fibrous tissue as I could and flush it out a little bit. Now it's not nearly, when I pinch it, it's not nearly as thick as it was. Okay, so this ear does have a little potential, has potential to get back to its normal structure. So what I have to do now is stitch this ear back up, but I don't close it. So what I'm going to be doing is just putting stitches through each side to keep it in place, but there's still going to be a little bit of an opening so it can drain, okay? We removed all that junk. It's going to drain. It eventually will heal. There's going to be blood that's coming here, oozing. It's going to clot. It's going to create a little scab here. It's going to stay here, and then eventually scabs they contract. And as the ear's going to heal, it's going to come closer and closer together. And we're actually just going to leave it like this. So what we found in the ear right here, it's actually a pretty smooth little blood clot, which was formed basically in the tip of the pinna in the ear. And if I kind of rupture it, oh, there we go. Yep. And as I squeezed it, sure enough, the blood came out. It just had a nice, it looked like a little engorged tick almost. Now, if I was to go and just take that blood out of there with a syringe, it would come back, right? So we have to basically do surgery to fix it, or surgery is the best option to fix it. So the approach that we did today was an S-shaped incision, and then we basically drained all the blood out, as you saw, and then once I got in there, I started to notice that there was a lot of fibrous tissue with mixture with some clots. And so with that, I just cleaned that out a little bit, kind of debrided it, because it was already becoming somewhat of a cauliflower ear that you would see in wrestlers. And so by cleaning that out, it kind of will allow it to go back to its normal shape.
His legs, so give him a minute.
Yeah, and he's peeing a bit.
He's like, hey dad, there you are. That's my dad. So he's still getting used to, you also put him on some fluids, so he's really got to probably pee. He's been peeing as he walks out here. If you want to take him for a walk before he pees in your car, that would be all right too. Okay. This may take a little bit for him to get used to. The only thing I tell people all the time is careful with your back of your knees. He'll come up behind you and clip your back of your knees, he'll forget it. And that's not a good experience to have. Other than that, everything should be normal.
Thank you, man.
Absolutely. Any questions, concerns at all, just give us a call.
Oh, you're a big boy.
Yes, he is.
Oh my goodness. 25 and an ounce.
He gained weight. I
Yeah, he
believe it.
did, he
He's been
did.
eating-
So our body condition right now, obviously 25 pounds for a cat. We are obese.
Yeah.
On a scale of 1 to 9, 9 being obese, we are at a 9.
Hey, buddy, you good?